Ghana Health Service organized 2022 Greater Accra Regional Health Directorate Annual Performance Review Meeting with the theme addressing the healthcare through intensifying health promotion, interventions, optimizing the use of data and technology to improve access to quality healthcare, strengthening preventive and control measure, emergence and re-emergence, public health event.
Rehabilitation, completion of stalled projects, construction of new ones, that's the Agenda 111, and the provision of essential materials, including vehicles and medical equipment. I wish to assure all health managers that the Greater Accra region will be provided with its due share in the various interventions planned by the government to improve health service delivery in the country. I want to use this opportunity to urge all health managers at the various levels to continuously collaborate closely with the metropolitan, municipal, and district assemblies to factor health needs in their programs so that the health challenges in your respective operational areas can be given the needed attention. It is my hope that this meeting will thoroughly consider your achievement and also reflect on the challenges of health service delivery in the region and tailor in achievable and sustainable interventions, innovations, and best practices that can improve our health outcomes.
And retention of human resources. These are areas that we are currently working on, but we pledge to work more to address those specific challenges that are mentioned. I'm also specifically delighted to see the theme addressing health equity in health coverage through 1, intensifying health promotion intervention, 2, optimizing the use of data and technology to improve access to quality health care, and 3, strengthening preventive and control measures for emergent and re-emergent public health events. These are quite important, timely, and surprisingly in line with what WHO does at different levels. The medium term, thank you, the WHO medium-term plan called the General Program of Work had 3 main pillars. The first one is supporting access to health services, 2, protection from public health events, and the third one is making sure that people enjoy better health and well-being. So this reads with the themes that we are prioritizing for this year. In line with this theme, WHO has been supporting in Ghana, including Greater Accra region, in a number of areas. For example, in the area of data and technology, we have been supporting evidence generation, including equity and coverage. This includes capacity building in equity assessment tool, conducting harmonized health facility assessment, district health systems functionality assessment, and evidence generation using the 11th version of International Classification of Diseases. Prevention of public health emergencies. WHO has been supporting evidence generation, including joint external evaluation, strategic planning, including preparation of the National Health Action Plan for Health emergencies. WHO has been supporting surveillance in response to a number of public health emergencies, including COVID, Marburg fever, monkeypox, and current Lassa fever, and others. Also been supporting health promotion, including addressing risk factors, as well as addressing different interventions in the area of nutrition. And we aspire to have a specific dialogue with the Ghana Health Service in discussing our areas of collaboration in the different thematic areas that I tried to highlight earlier, including the different directorates in Ghana Health Service, and hopefully with the regional directors under the leadership of the director.
We are leveraging on technology to solve our problems and make life easier for staff and our clients. We shall soon launch the digital health strategy, and we are open to new and innovative ideas as we move forward. We are currently partnering with USAID, the Grand Challenge Canada, AMP Health, and others to implement the first country innovative platform in Ghana, where we seek innovative ideas to solve specific health challenges. And we shall announce a call for proposal in the next couple of months, and we hope that Greater Accra will participate strongly to ensure that they also share all the many ideas that is taking place. The national theme for this year's performance review is harnessing resources to improve service delivery in the era of emerging and re-emerging ideas, the role of managers. Obviously, the regions have the right to adapt it. This theme was carefully chosen to reflect the urgent need for managers at all operational levels to harness resources to improve service delivery, notwithstanding the ravaging impacts of emerging and re-emerging diseases such as ongoing COVID-19 pandemic, monkeypox, Lassa fever, Marburg that we had to control. And in all this, Greater Accra has been the champions COVID-19, monkeypox, and Lassa fever. So well done for being able to contain them. Review to touch on key deliverable areas such as the performance agreement signed between the regional director and my office. The regional director signed the performance agreement on your behalf. You are the ones going to deliver. These areas broadly include the provision of essential services, management of clinical and public health emergencies, which you are doing very well, improvement on quality of care and information management, as well as enhancing efficiency in human resource performance. Specifically, the region is expected to improve implementation of quality strategies, ensure equitable distribution of health workforce, improve maternal and reproductive health services, which I'm sure by the next 2 days we'll talk about, and comply with the IGF guidelines, among others. This is very, very important. IGF guidelines is not the contribution you make only. It is also how you make your budget and get it approved and spend on your budget. Hopefully these areas will feature prominently in your review. Chair, for the outlook of 2023 promised to be brighter. This notwithstanding, COVID-19 is still with us and may be for a long time. We have clusters of influenza and only recently, as we mentioned, Lassa fever. I am happy with our public health emergency response system in place, but I must reiterate the needed resources to improve services we provide, notwithstanding the ravaging impact of these emerging and re-emerging diseases. To this end, let us continuously promote the benefit of COVID-19 vaccination and teach all and sundry to take seriously the preventive measures against Lassa fever and other diseases as well as implore our biggest resource, i.e. our human resource for health, to continue to give out their best and improve service delivery. Dr. Chair, I am proud of all the hard-working staff who strive day and night, wade through the rivers. There are rivers in Accra. If you go to Test, you see them in lakes, climb hills, and walk endless miles in the sun just to ensure good quality care is provided to the good people of Ghana.
Thank you for watching Nation One TV. Kindly subscribe for more news updates.